Are you experiencing chronic soreness on your top abdomen? Don't brush it off. It would simply be your body sending out an early warning sign that your pancreas is in hassle. Welcome again to our channel, in which today we are delving deep into the complicated international of pancreatic health. Before we unveil the symptoms of a struggling pancreas, let's first try to understand what role this organ plays in our bodies. We will also discuss what happens if the pancreas shuts down completely, what causes someone to develop pancreatic disease. Finally, we will take a look at ingredients and way-of-life modifications that can help revive a struggling pancreas. So first, what's the function of the pancreas? The pancreas serves as a critical organ within the human frame, playing indispensable roles in both the digestive and endocrine systems. Its multifaceted functions are crucial for preserving universal health and adequately being. The pancreas is a powerhouse for digestion and hormone regulation to your frame. Regarding digestion, it releases unique chemical compounds called enzymes that break down the meals you devour into smaller parts so your body can take in them better. These enzymes paintings on proteins, fats, and carbohydrates in your small intestine and the pancreas facilitate neutralizing the acid from your stomach, protecting the inner of your small gut from getting irritated. If the pancreas does not make enough of these enzymes, it could cause issues like inflammatory bowel sicknesses, making digestion painful and hard. Aside from digestion, the pancreas additionally makes essential hormones like insulin and glucagon. Insulin helps control the amount of sugar in your blood by helping your cells absorb it. Glucagon does the alternatively. It increases your blood sugar when it's too low. Together, insulin and glucagon ensure your body maintains the proper sugar balance in your blood. This helps your body use the power from the food you devour efficiently. Those hormones additionally affect how your frame shops and uses electricity for exclusive sports. Please like the video and subscribe to the channel if in case you're getting a price out of this. So what occurs if the pancreas dies? 1. Digestive problems. Without the pancreas, the body might lack vital enzymes to break down meals in the digestive device. This will cause malabsorption of vitamins, resulting in malnutrition, weight loss, and deficiencies in critical nutrients and minerals. 2. Diabetes. The pancreas produces insulin, a hormone essential for regulating blood sugar ranges. Without insulin, glucose cannot enter cells correctly, primarily due to excessive blood sugar ranges. This circumstance is called diabetes. If the pancreas were to die, the frame might no longer produce insulin, resulting in out-of-control diabetes that could result in severe headaches, inclusive of cardiovascular disease, kidney damage, nerve damage, and blindness. With this out of the way, we will try to understand pancreatic sickness, often start with a circumstance called pancreatitis. This may be either a quick time period acute or lengthy lasting continual, and it's complex to identify because its signs can appear to be other fitness troubles. When someone has acute pancreatitis, they could throw up bile, feel an ache within the upper stomach, and turn yellowish. Just these signs and symptoms may be pressured with belly troubles, which can also cause them to delay getting assistance, but it is essential to behave speedily because during an acute pancreatitis episode, the pancreas can get severely damaged after the extreme phase. Symptoms would possibly leave on their personal that can make humans think they just had an awful case of food poisoning. However, if pancreatitis isn't always nicely treated, it can develop into a chronic condition. In continual pancreatitis, the pancreas regularly receives worse as healthful tissue is changed by scar tissue, inflicting digestion and hormone problems and subsequently central to diabetes. So it is critical to recognize the signs and get hospital therapy early to prevent extreme issues afterward. So what causes pancreatic ailment? Pancreatic sickness can emerge from many things, each probably triggering inflammation and damage to this vital organ. Most of the primary instigators are gallstones and prolonged immoderate alcohol consumption. Gallstones can hinder the pancreatic ducts, leading to infection and damage. Continual alcohol abuse can then result in chemical alterations in the pancreas, extensively growing the probability of irritation. Moreover, worrying activities affecting the stomach along with injuries have been diagnosed as a capacity catalyst for pancreatitis. Positive medicinal drugs, starting from antibiotics to diuretics, have additionally been related to the onset of pancreatic illnesses, as they will initiate unfavorable reactions in the pancreas. Extended stages of triglycerides in the bloodstream pose another significant threat factor, mainly once they reach rather excessive ranges of infectious agents like the mumps virus and autoimmune problems, wherein the frame erroneously targets the pancreas, are additional trigger for inflammation in this organ. Furthermore, genetic predispositions can play a pivotal function in improving pancreatic diseases. Precise mutations may heighten an individual's susceptibility, rendering them extra susceptible to experiencing inflammation and subsequent complications in the pancreas. Therefore, the same time as the reasons for pancreatic diseases can vary, they often proportion a not unusual topic of triggering inflammation and disruption within this essential organ. Early signs of pancreatic disease. 1. Persistent abdominal pain. One of the preliminary signs might be a chronic ache inside the top abdomen, frequently at the left aspect, with occasional radiation to the brigand. This pain may be accentuated after meals, specifically those rich in fat, at the same time, as it may resemble signs of different situations like gastritis or ulcers. It can characterize underlying pancreatic issues. 2. Recurrent episodes of unexplained illness. Frequent bouts of unexplained sickness, resembling signs and symptoms of poisoning, have increased concerns. These episodes can also occur periodically without identifiable triggers, doubtlessly signaling early pancreatic disorder. 3. Greasy bowel movements. While the pancreas fails to produce enough digestive enzymes, fat won't be well damaged and absorbed via the intestines. Consequently, undigested fat can bypass the digestive tract, resulting in greasy, oily stools. Those stools might also seem bulky and can go with the flow in the restroom due to their excessive fat content material. 4. Jaundice. Jaundice marked through yellowing of the skin and eyes due to improved bilirubin stages can suggest pancreatic disorder, often due to the pancreatic head obstructing or compressing the bile duct, hindering bile waft and inflicting bilirubin buildup. Additionally, impaired pancreatic features cannot directly affect liver characteristics, exacerbating jaundice. 5. Fluctuations in weight and chronic fatigue. Sudden and unexplained fluctuations in weight followed. Utilizing persistent fatigue can be indicative of underlying pancreatic dysfunction. Individuals might also revel in both weight advantage and weight loss, regularly observed through continual tiredness as their pancreatic health deteriorates. 6. Abdominal bloating, persistent belly bloating, which persists regardless of dietary modifications or lifestyle changes, may sign pancreatic involvement. This symptom, although non-specific, has to prompt scientific evaluation mainly while observed by other capability signs of pancreatic dysfunction. At the same time, as those signs are non-particular and may be attributed to various situations, the emergence of any of those symptoms warrants setting off scientific interest. Only a healthcare professional can appropriately diagnose the underlying reason and propose suitable remedy strategies. Now we are going to look at foods and lifestyle changes that can help restore back a dying pancreas. 1. Healthy diet. Focus on whole, nutrient-rich foods together with fruits, veggies, entire grains, lean proteins, and healthy fat-containing foods rich in antioxidants, which include berries, leafy greens, nuts and seeds, which can help reduce inflammation and oxidative stress in the pancreas. Limit processed foods, refined sugars, and unhealthy fats, as they can contribute to inflammation and exacerbate pancreatic damage. Monitor carbohydrate intake, as excessive consumption can strain the pancreas by requiring an increased insulin production for complex carbohydrates and limit simple sugars. 2. Balanced blood sugar levels. Preserve solid blood sugar stages using eating average food and snacks throughout the day. Pick low glycemic index foods that have a slower effect on blood sugar tiers, including entire grains, legumes, and non-starchy veggies. Avoid sugary beverages and cakes that could cause rapid spikes in blood sugar. 3. Hydration. Drink plenty of water for the day to stay hydrated and assist proper pancreatic function. Dehydration can exacerbate pancreatic issues. 4. Limit alcohol consumption. Alcohol may be hazardous to the pancreas, primarily to infection and harm. In case you drink alcohol, do so moderately, or don't forget to abstain altogether. 5. Quit smoking. Smoking is a first-rate chance aspect for pancreatic illnesses, which include pancreatitis and pancreatic cancer. Quitting smoking can help save you, in addition to harm to the pancreas. 6. Maintain a healthy weight. Intention to achieve and keep a healthy weight through a balanced eating regimen and ordinary physical hobbies. Excess weight can increase the danger of pancreatic issues and exacerbate existing conditions. 7. Regular exercise. Interact in regular physical interests consisting of taking walks, strolling, swimming, or cycling to sell usual health and enhance insulin insensitivity. Exercise also can help manage weight and reduce inflammation. 8. Stress management. To decrease pressure tiers, practice strain discount strategies along with meditation, deep respiration, physical games, yoga, or mindfulness. Chronic strain can negatively impact pancreatic health. 9. Supplements. Talk with a healthcare professional about potentially beneficial supplements containing omega-3 fatty acids, diet D, nutrition E, and magnesium, which can also assist pancreatic health. 10. Medical treatment and monitoring. Follow any prescribed medical treatments and attend regular checkups with healthcare companies to reveal the pancreatic function and deal with complications immediately. It is essential to consult with a healthcare professional or a registered dietitian before making giant nutritional or lifestyle changes, particularly when you have precurrent pancreatic circumstances or other health issues. They could offer customized recommendations primarily based on your desires and clinical records. In case you find the cost in this video, remember to assist us by liking the video and subscribing to the channel for more motion pictures on keeping our delicate organs healthy.